Hello everyone, my name is Dr. Player. I am a resident physician currently in a public health medical residency, and today I wanted to talk to you about AI, but from a public health perspective. My disclaimer is that these are my own opinions. These are not the opinions of any of the institutions I'm affiliated with, no one I work with. It's purely coming from my own thoughts and feelings, and I have no conflicts of interest. No one's paying me to say any of these things. My only real interest is in promoting public health. So for the sake of argument, for the sake of this whole conversation, let's set aside the bad uses of AI. And there are a lot of seriously bad uses of AI that include non-consensual, explicit image generation. It includes notoriously health insurance companies like United Healthcare automatically denying health insurance claims in a fraudulent manner. It includes, potentially using AI to choose targets, to decide who to kill, removing a layer of individual choice and accountability in terms of making decisions in war. It's been used notoriously to fake political ads with deepfakes, with fake videos, say things that have not actually been said by individuals, deceiving a lot of older members of the population who are not as familiar with spotting out some of these inconsistencies. Let's even set aside the totally valid moral argument that if something is more bad than good, if it has more bad use cases and more of it is being used for bad things than good, that you should just abandon that thing. And I do want to make clear that that's a reasonable moral argument to make, but for the sake of this conversation, let's even set that aside and let's just look at problems that are truly inherent to AI use. No matter what, if you're using AI, you are contributing to these issues. So let's look at water consumption. This is something that I am not as familiar with. I'm not a tech person. That's outside my specialty. I'm not going to pretend that it's something that I am familiar with. So let's get a bit of an idea for what some of the literature says about that. This is an interesting one because, when I clicked on this article, it just doesn't seem to exist. That's not something that traditionally you run into with research. Most often you might see something about a retraction or an edit or a revision. This one just disappeared. And that's something that kind of makes me suspicious that someone didn't like what it said. Fortunately, I was able to find the actual article itself. And in that article, it says specifically that workload level water use variations exceed 10,000-fold. And so just to say that very clearly, the variation in what's been noted for water use is like 10,000 times. There's a huge amount of variability, and that is concerning. How are we supposed to know how much water is being used if there's so much variation? So look at it from another perspective. I found this article in a law review talking about how turns out there's not really any regulation, there aren't really any policies in place about water use, and it would be really helpful if there were. But let's see what we can find in terms of actual concrete numbers. Here we have a huge range, 312.5 to 764.6 billion liters of water. That's a lot of water. It's a lot more than I use when I take a shower. There's still a huge variation there, but at least we're getting somewhere. Lots and lots of water. When we don't have a lot of other evidence, we can always turn to anecdotal evidence. It's not as high of quality, but it is something. So let's see what articles we're able to find about people's experience with it. We can see that rural towns might be running out of water. Some of these areas that need water maybe even more than others are running out. Oh yeah, actually, so it turns out there's a ton of articles talking about this. Tons of places are running out of water. Water use is going crazy, and a lot of water specifically seems to be disappearing from vulnerable communities that are rural and in deserts. So, in summary, the water consumption seems to be pretty much unregulated. It seems to be unclear, potentially even directly hidden, because we're not getting reliable numbers from data companies or data centers about their water use. It does seem to be a lot still. And it seems to be specifically, or at least in particular, affecting people who really need water to survive, probably people who live somewhere anticipating water to be available and are having difficulty acquiring it. But we're also seeing a lot of things talking about water quality as well. There's sort of one particularly notorious article talking about a woman who has just a bunch of dirt, sediment building up in her water. She lives right next to a new Meta AI data center. According to Meta, they investigated themselves and found no evidence of wrongdoing. They said they did not affect groundwater. So it's their word against her word. Except actually, there's more people involved in this conversation. We have AOC, who went to this lady's house, and she's holding something. It looks kind of like a jar of dirt, but actually that's water directly from her drinking well. And not only is sediment buildup in the water ruining people's machines, like there are appliances that require water, like fridges and washing machines and dryers, but also there's a big concern about chemical pollution, because the water that's being used by these data centers for cooling primarily is being treated with chemicals. That chemical water risks running off. It risks leaking into nearby areas. It's water that cannot adequately be used by other people. And so not only is the quantity an issue, but also the water quality is an issue. It's being filled with chemicals, it's being filled with dirt, and what water remains next to these data centers is often being polluted. Let's talk about air quality. You've probably seen some of these many articles talking about air quality, perhaps most notoriously some of these illegal methane turbines that have been built with XAI. And in fact, those turbines are so problematic that the NAACP is suing XAI because the location of this data center is disproportionately affecting black neighborhoods. And so, hey, maybe even though there's this air pollution going on, at least we can rely on the legal framework to help protect people. Except that doesn't actually seem to be the case. It seems like our federal administration is currently telling them to not prosecute, discouraging this from happening, and favoring the richest man in the world instead of these local communities and their welfare. And something I'd like to talk about specifically, because we talk about, water use, we talk about pollution, and, air pollution, it's a bad thing, it contributes to climate change. Even if you don't believe in climate change, I think you can understand that air pollution is a bad thing, and it has intense local effects. From a public health perspective, there are at-risk people, and so I wanted to bring this up, the fact that this paper estimates deaths and hospitalizations that will be caused by air pollution and air quality problems. People with asthma are at risk of having an asthma exacerbation, of going to the hospital, of dying. People with COPD, people with any kind of lung vulnerability, children that are exposed to these things are at greater risk. And so there's a very real risk of people dying, having premature deaths, and being, along with that and along with hospitalizations, there are broader societal costs of lost productivity. This one's specifically looking in that area. In Memphis, next to XAI's data center, and they projected an increase in pollution in tens of millions of dollars of health damages that they're not paying for, right? Especially if lawsuits against them don't come to fruition. It's going to cost millions of dollars to these at-risk people, but hey, as long as it's making the richest man in the world a little bit richer. And so, in summary, there's tons of pollution. It's often illegal, and it's disproportionately affecting underprivileged groups, and it will kill and hospitalize people. Let's talk about noise pollution. You may have seen some of the reports talking about noise pollution, but you likely don't understand the scope of how serious it really is. There's been a lot. You can definitely look up these videos of people just standing next to a data center and the extreme noise pollution that's occurring next to them. I really love the work Ben Jordan did on this, looking at infrasound, as well as just generally like the risks of noise pollution. And it's a really big issue. And so let's talk again about the health side effects of that. Instead of just, being irritated by loud noises, there are really genuinely effects that can cause disability in people. Most people aren't aware of how serious it can be. The most common thing people think of is like noise-induced hearing loss. So, something's too loud for too long and then you end up losing your hearing. But there are a lot of other diverse negative impacts. If this is running through the night, you have sleep disturbances. You can get irritable. It can affect your ability to learn, to focus. The stress of it can really negatively impact you. There's data, specifically talking about cognition, ability to think, ability to focus. There's studies looking at aircraft noise in children talking about causing issues with their ability to learn and understand. So cortisol, the stress hormone, if you have this loud ambient noise all the time, cortisol is associated with tons of cardiovascular risk effects. There's actually pretty strong data talking about risks of heart attack and stroke due to noise pollution. Nighttime noise exposure can lead to hypertension or elevated blood pressure, which also can cause heart attacks, strokes, all of those things. Increased cortisol can lead to diabetes, and it can worsen depression and anxiety. And so this really is like a genuine public health disaster. There really is a serious issue here. It's not just loud noise, put on some headphones and go about your day. This will also really hurt people. It's severe and it can cause disability and death. Let's talk a little bit about electricity use. A lot of this electricity use is directly related to the pollution, but there's also there's other, practical issues. The fact that there's a huge draw of electricity means that there are going to be increased costs for individuals. And so we have finite power grids, right? That's an important thing to understand, is that there's an existing infrastructure. There are power lines, there are transformers, there's all these things that exist in society that regulate electricity. And if you build a giant thing that's sucking a bunch of that energy away, then that's no longer available in the same proportion, and that can overload these systems. You can run out of power, you can have brownouts, you can have blackouts, you can have other issues when the grid is overpowered. And not only that, but electricity is usually priced with sort of demand style pricing. And so the more it's in demand, the more it's going to cost you to have your own electricity. That works sort of in what we call a regressive tax type way. The idea being that, whether or not you're rich or poor, there's not going to be a huge difference in the amount of electricity you use most of the time. And so if you're poor and your electricity bill goes up, that represents a higher percentage of your overall income that's disappearing. And if you're rich and your electricity goes up, that's a lower percentage. That's a regressive tax. It affects poor people more than it affects rich people. And similarly, when we talk about grid failures, which is a very real concern, then you have to think about the practical implications of that. That means that there's no heat in winter, there's no refrigeration, there's no cooling in summer. And a lot of these issues are, on an individual level, they are an inconvenience. It's not fun, it's a pain in the butt, etc. But you have to understand that from a population level, from a public health perspective, these types of things are not inconveniences. There are vulnerable people who will die without them. There's always a certain number of people in the population, perhaps they're old, they're frail, they're already dehydrated or at risk or sick for some other reason, and then suddenly they have no air conditioning in the middle of a hot summer. Those people could die. And that's not going to be most people, but many people are at risk at that level. Similarly, lack of refrigeration, lack of just being able to see in your house, if you're already vision impaired, this will kill people. And so we can see electricity use can lead to dangerous power outages and high bills. So let's look at a case study. Let's look at the data center, the Stratus data center by Kevin O'Leary, the so-called Mr. Wonderful, perhaps Mr. Terrible would be more apt of a moniker, and he wants to get this data center approved that's twice the size of Manhattan in Utah. There's been a lot of already shady political maneuvering in order to get that pushed through, but also the environmental impact is absurd if you look at it. It's projected to use more electricity, or like double the entire electricity consumption of the entire state. We have this really useful paper that was done by these people that show, hey, there's sort of two options: massive water use or massive air pollution. Either way, it would radically change the water use or the air pollution across the entire state level. 16 billion gallons of water use per year or potentially 12,000 tons of emissions in the year, depending on which model that they use. This is in an area already that has diminishing water. The Salt Lake is disappearing. It's mostly a desert in the state, so hugely problematic. We have interesting papers using units I've not considered before to measure heat release, 23 atomic bombs worth of heat release per day. And with the possibility of raising the projected temperature nearby at night of like 8 to 12 degrees, which surely will have a huge ecological environmental impact. And then of course there's all of these secondary costs that we've already talked about: risk of power grid failures, risk of asthma exacerbations, noise pollution, hospitalizations, deaths, water pollution, dehydration, and increased costs. Now, I do have to throw out a little bit of a disclaimer here. With the increase in political pressure over the course of me even preparing this presentation, there has been enough pushback that, initially Kevin O'Leary was saying, hey, they're shipping in protesters. Surely Utahns couldn't actually care about this data center. He retracts that statement. Eventually, everyone is getting so angry that they say that, hey, we're going to reduce the footprint to a quarter of what it was originally. So there's a chance that political activism has actually had some kind of positive outcome here. But you also have to take this with a grain of salt, because we've already seen many times in the data center playbook that they will sort of initially withdraw what was said, and then once everyone stops worrying about it and they take that at face value, they will discreetly restart the original plans. They'll have elected officials sign NDAs, which I guess is somehow legally acceptable, and they will go through the whole process again. And so you have to completely be vigilant against these things. And again, I want to talk about equity, right? This is a very important topic for public health, because these data centers are not impacting equally the population. Kevin O'Leary is not trying to build this data center in his own backyard and suffer the consequences. He wants to build it in the United States. A lot of these we've already seen with, the XAI data center. These are being built next to vulnerable populations, minority groups, people who have less political power, less of a way to fight back. They're being built in states with less consumer-friendly regulations, with less protective regulations, and I predict we're going to see this really worsening the health outcomes and the disparities that are already so prevalent in the US. And another issue that this brings up is the fact that for some reason our government really loves paying for private businesses to succeed. And they do this thing where they take our taxes and then they use that tax money to give like a 50 million handout to Tesla to hire people instead of just like making the company be profitable on their own. And so again, there's sort of this weird regressive tax thing going on where we're just taking money from the poor and giving it directly to the rich. And we see a lot of this same pattern happening with data centers, where you say, hey, this is helping the economy, this is bringing jobs. Well, actually, we're taking money from the poor people so that this can continue to exist. We're giving tax breaks, and so they're actually not paying taxes in a meaningful way. They're not bringing back to the community. We are taking your money and giving it to a private company instead of using it to pay for public services like healthcare. That's kind of a hot topic from the government. Is, can we afford Medicare and Medicaid? Can we afford food stamps? Well, we can. We're just giving that money to data centers instead of giving it to public services for people that need it. And then, of course, there's another sort of broader concern with equity in terms of the existing biases in healthcare and in data sets already. AI is being used to look at these data sets, and a lot of these data sets have historically been biased. They have included only white men, or they have not represented the population of the United States in an accurate way, and that has skewed them to disfavor certain groups. It's historically a big problem with medical studies, with all kinds of studies. So AI is looking at these already imperfect data sets, and AI is not something that is being controlled by this neutral, benign leader, right? AI is being controlled by rich people who have agendas. I think this, the most notable example would be Grok, when Grok started calling itself Mecha Hitler, and you can see that it was kind of fed a poisonous data set. There were a couple of little tiny adjustments made on the back end, and it started doing very problematic behaviors. People are using these things to inform themselves when they may be worsening pre-existing biases and compounding them, and that's going to have really bad downstream effects for these vulnerable groups. Now, that's a lot of the negatives. I do think it's important to give a somewhat balanced take on AI, okay? Despite the fact that most of it's marketing hype, it's being, touted to perform things that it can't, and that there's a huge vested interest in it, and the market's extremely speculative surrounding AI in a very dangerous way that risks everyone's retirement funds. There are valid use cases for AI. AI is good at some things. Most of those things are looking at processing large amounts of data. Historically, in my field, we think about that in terms of analyzing large scientific data sets, doing some basic statistics. Similarly, a lot of people use it in business, and to a certain extent, that might be a valid use case if you own or operate a large business that works with a lot of data. You might be able to predict things in a useful way. You might be able to analyze trends in a way that could be burdensome or difficult otherwise. AI is also good at recognizing patterns generally, stuff like speech recognition. It can generate basic templates, outlines, things that most of us can still do on our own anyway, but if you're feeling lazy, you could do it. So there are some valid use cases. People will probably be quick to point out a bunch of the things that I didn't just mention. And a lot of the things that people use AI for and say that that's like a good use case, I still fundamentally disagree. Research I mentioned, but it's already very problematic. I'm seeing lots of stories from people who have been falsely attributed as authors of papers. AI, people are using it to do research, and it's saying, hey, this person wrote this thing, and it doesn't exist. It's a hallucination. They are saying that papers exist that don't exist. They are saying that the paper said things that the papers did not say. So that's super problematic. And part of why that's really problematic is that there's sort of some baseline rate of hallucination that's going on with AI, and people are not responsibly fact-checking every single thing. If they did, it would just be easier to write it on their own anyway. And then people are using AI to do more research after that. And so you publish a paper with AI hallucinations in it, and then you use AI again to read the thing that has hallucinations in it, and then it's adding another layer of its own hallucinations to that. And you have this quickly degenerating downward spiral of slop, where you get this like Ouroboros beast of AI producing more slop, eating slop, and then you can't trust anything that's written anywhere. And you can say, well, hey, like, what if people are using it really ethically? They're fact-checking everything. They are doing good science. And that will always continue to happen. But the issue is that it won't happen at an adequate rate, because most of the people who are relying heavily on AI for increased output and productivity, these are already like mass production, paper mill kind of researchers, right? The people who are really using it are producing junk science. They're selling papers, they're selling authorships, they're taking advantage of needy people in a publish-or-perish society, and they are going to massively outstrip production in junk science over the good science. And it will dilute the good science into non-existence until we can't trust any of the research that's been done. And so most of the research applications and trying to facilitate research is extremely problematic, in my opinion. Similarly, I don't know that too many people who openly and proudly endorse AI's ability or their ability to write a prompt as an artist and produce some kind of like audio-visual material, but this is just intellectual theft. Hopefully all of the lawsuits surrounding it pan out, but if nothing else, it's a pure moral loss. There's nothing good from producing soulless AI slop content instead of just paying someone adequately to do it or to license their things. A lot of people are using AI to vibe code, to learn, to think for you. This is, again, a very problematic thing. AI has been shown to rapidly de-skill people. People who rely on AI to do things will find their performance in that thing unassisted without AI rapidly decreases. And people will say, well, you just need to be smart, you need to use it in an appropriate way, et cetera, et cetera. And again, maybe for an individual that could prove to be true, but you have to think about a population level, and AI is being exposed to the whole population. And what is biologically favorable for people's brains is to do something that is less energy intensive, and that is less critical thinking. So no matter what, there's going to be this drift towards using AI to do all critical thinking. The greater issue as well, especially in my field in healthcare and medicine, is that there's a real concern that people are going to never develop the skills that they need to do because they're already using this crutch. They're never building the understanding that they need. A lot of people that are touting AI is so good at this and that and the other thing with medicine are using these super narrow studies, these terrible data sets. They're usually being published by someone with conflicts of interest who runs an AI company. They're looking at Reddit posts and doctors' responses to Reddit posts and trying to use that to say AI is empathetic. And AI does okay at reading a prompt where all of the necessary answers are there and then selecting a multiple choice answer. But AI does not do a good job at actively managing a patient, managing risk. And we see a lot of these particular issues, huge error rates when it comes to these like marginal cases where things are less certain and where they're less clear and the risks are higher, and AI does a really bad job triaging that. And so, the concern is that physicians aren't going to even develop those skills because they're using it so much. And for the broader population, there's this concern that people are just losing the ability to think independently. They aren't able to do things that they once could easily do without asking an AI to tell them what to think. And this is absolutely what AI companies want to happen. This is what they need to happen in order to become profitable. If they can make cognition and the ability to think like a normal human being a luxury for people to pay for, then they will have completely won. People will also use AI to build some kind of business, etc. This is largely a get-rich-quick scheme. Most of at least what you see online. I'm sure people are using it effectively in their individual businesses. But when it's being touted as a way to scale your business so much bigger, to make all this money, to do something easily, it's a get-rich-quick scheme. They do get-rich-quick schemes for every service that exists. For whatever it is that you want, there's a get-rich-quick scheme. And if it's so easy to scale, then everyone can do it, everyone will do it, and it will eventually reach an equilibrium where the effort is not worth the value anymore. People will also talk about how AI is, revolutionizing some kind of product. Most of the time, this is solving a problem that AI or these companies have already caused by lowering the quality and standards. Google search once was an effective tool. Now it's super problematic with ads. It's super problematic with crazy SEO optimization. And so now they're adding hallucinating AI on top of that to read the articles, to not support the people who actually maybe produce the content in the first place, and then half the time it's wrong about what it's saying anyway. Similarly, people are trying to replace like customer-facing roles with AI. They're having sophisticated sounding people on the phone, except it's actually just an AI, and they're not able to handle things that people actually want. You're not able to talk to them, and so they're having issues with it, so they build a smarter AI to manage those dumb AIs. Again, you could just hire a worker to do this thing instead of following whatever your company's policy of incorporating AI into everything to capitalize on the hype is. So here's the main takeaways. This is really what I want people to think and understand. From a public health perspective, AI is super damaging, not only to the environment, but the environment is directly tied to our health. Water pollution, air pollution, noise pollution, these things are hurting people. AI is inherently damaging. Remember, this is setting aside all of the bad things that AI is doing that are really bad for people's health. No matter how good the thing is that you're doing with AI, you are harming people by using it. It follows that if you're using AI in the field of public health, you are poisoning the well you drink from. You are harming people in search of the cure. You are maybe hoping that you can outpace the bad that you are doing by doing some kind of good with it. And I encourage you to not do that. Because if some AI company can point to you and say, hey, the doctors need us, the public health workers need us, then that gives them a greater license to go fast and break things and not apologize and not be legally accountable. You are hurting the people who need it most when you are using AI tools. AI does have potential to be good. It's a useful thing in certain specific controlled contexts. And I do want to make that clear. There are some possibilities. And ultimately, when the cat comes out of the bag, you can't put it back, right? AI isn't going to disappear. It's not going to become a defunct technology anytime soon. But even if the cat's out of the bag, you can litter train it. You can make it run around and chase a laser pointer. You can use it and manipulate it and control it and regulate it, most importantly, in an effective way, in a safe way that's not going to hurt people. And so, public health workers, doctors really need to be examples of effective AI use. And in most cases right now, I would strongly encourage that to mean abstaining from AI and really lobbying and advocating for regulations limiting AI and waiting and protecting the people that are currently being negatively impacted by AI data centers until those policies and those regulations can be put in place first. We don't want to discover what went wrong 20 years from now, when we built a data center next to someone that killed people, we would rather prevent that from happening and use it to solve all of the other problems that we already have instead of making new ones. Those are just my thoughts. I know that those aren't going to be everybody's thoughts. I'd love to hear everyone else's thoughts in the comments. Feel free to fight me and to push back on some things. But I feel like I haven't seen much of comprehensive takes on this from a public health perspective. Public health really matters to me. Serving as many people and helping as many people as possible is really important to me. And I think that this really is a public health crisis that needs to be addressed, and it needs that public health lens to regulate it and bring it in. Hopefully this was helpful. Hopefully this was insightful. Thanks. See you guys next time.